Our next presenter, with reflections on the future challenges and opportunities in a post-COVID world, will be Dr. Andres-Jacques Neusy, the co-founder and senior director of the Training for Health Equity, or the NET project. He is an honorary associate professor of medicine at New York University School of Medicine, where he co-founded and directed a cross-disciplinary center for global health. A leader in health workforce education, Dr. Neusy has consulted on health workforce development for academic institutions, governments, bilateral agencies, and international organizations. He spent much of his childhood and youth in the Congo, in or near the city of Congo, where his father was a Protestant chaplain with the army.
Hi. It is a special pleasure for me to be part of this series of discussion. I want to thank the organizer for inviting me. And it has a special significance for me because I have a very special bond with the Democratic Republic of Congo, and more specifically with the province of Kasai, where I spent my childhood and adolescence in the city of Kananga. I am the senior director of the Training for Health Equity Network, or the NET, an international partnership of academic institutions committed to train health professionals with a sense of dedication to serve where the needs are the greatest. Our academic partners are located on 5 continents, and they work across sectors. And what is the common thread between them is that they are community engaged and work with the community they serve with a focus on the underserved. COVID-19 has hit an unequal world riddled by inequities and inequalities, and it is not only a health crisis, it is a human crisis affecting the very fabric of our society. It has highlighted the existing inequalities, not only between industrialized nations and developing countries, but also within wealthy countries where racial minorities and lower social economic classes are disproportionately affected as a result of ongoing discriminations that prevented them from having fair opportunities. This pandemic is a massive challenge. It highlights the urgency for a multi-sector approach needed to align and coordinate health systems with other sectors, such as public health, social services, education, transportation, sanitation, and other essential utilities frequently undersupplied in poor countries. The pandemic also caught our health systems unprepared. Poor, under-resourced regions with feeble health systems have been hit particularly hard. Our organization, the NET, primarily focuses on the education and retention of health professionals in areas of need, as I mentioned. But it has long recognized the need for a more effective integration between education, health, and social systems, whether in developed or developing nations. We work with partners in different African countries, including the Democratic Republic of Congo, where we collaborate with 2 universities located in the eastern part of the country, in the province of South Kivu, in the city of Bukavu. They are the Université Officielle de Bukavu, or the State University of Bukavu, and l'Université Évangélique d'Afrique, or the Evangelical University of Africa. In 2018, at their request, our organization conducted an assessment of their priority need, the needs of these institutions. Both universities have a School of Medicine and Health Sciences and a teaching academic hospital. These 2 hospital centers are the most important referral healthcare facilities for the city of Bukavu and the entire province. They provide the education and clinical training to future doctors, nurses, midwives, public health officers, and other health professionals, as well as they deliver the medical care to their population, carry out research, and public health activities. The evaluation revealed how the lack of a stable source of electricity affects negatively the training of healthcare professionals, the development of their own faculty in their teaching duties in the hospitals and other clinical sites, as well as the delivery of healthcare services themselves. These institutions, as you very well know, share similar conditions as those in the rest of the country. The majority of hospitals and universities in the DRC face the same issue, namely an unreliable provision of essential utilities such as electricity, drinkable water, the disposal of biomedical waste, and access to broadband internet. These utilities are essential to ensure the good functioning of health systems and educational institutions. Of course, for example, the two campuses in Bukavu and their hospitals are frequently facing daily interruption of electricity, making them dependent on costly and polluting diesel generators. This has a direct impact on essential services, such as the maintenance of cold chains for vaccination, the functioning of laboratory services, and the functioning of clinical equipment necessary for patient care. The lack of a steady supply of electricity impacts negatively the development of the IT infrastructure and the development of digital platforms vital for public health surveillance systems. Public health surveillance systems, particularly these days, require accurate and timely data collection and analysis, and the capacity for sharing vital data locally, regionally, nationally, and with the rest of the international global health community. At the time of COVID, lives depend on building an effective online surveillance system. And it is essential for these educational and health centers to have also the capacity to develop and implement e-education, electronic education, and electronic health, e-health programs. These institutions also lack adequate libraries. Their libraries are grossly inadequate. And in the midst of COVID-19, they still don't have a safe water and sanitation system that is essential for preventing the spread of disease. The hospitals and clinics also lack a safe and adequate biomedical waste disposal system. So, to address these priorities, our organization, in partnership with our two local partners, these two universities, and with a French non-for-profit organization called Scale, have developed a project in collaboration with local and international companies and other partners, with the support of the Congolese government, of course. These projects consist of a feasibility study of integrated and replicable legal and contractual solutions aimed at achieving an economy of scale in providing essential utility services that are technically and economically optimized to meet priority needs of the health and educational systems of the city of Bukavu. The project will provide the necessary infrastructure for academia, local authorities, and healthcare providers to benefit from digital advances and online resources. By having access to stable and sustainable energy, local partners will be able to strengthen data collection, analysis and dissemination, obtain diagnostic tools online, in particular by using artificial intelligence, enable students, teachers, and healthcare providers to participate in online and distance learning activities, to have e-education and to have e-health, and to have access to an electronic library. Integrated and decentralized infrastructure management will strengthen local and global coordination, will strengthen preparedness and response to pandemics and other disasters to come. The COVID-19 pandemic underscores the need to rethink the concept of health in the larger societal context. A big lesson from COVID is that this pandemic is exacerbating the disparities and the inequities in health outcomes. It has the heaviest impact on the lives of people living in deprivation or facing difficult social economic circumstances. Socially and economically vulnerable population, as you know, suffer disproportionately. Let's remember, this is really important, let's remember that good health starts in the community, not in the clinics, nor in the hospitals. In the long term, we must reconsider the kind of health system that is capable to protect everyone, whether in time of crisis or not. We need to rethink what is a health system that works for all by moving from inpatient hospitals to strengthening primary care in the communities where people live. We must make smarter investment, moving from spending big dollars in hospitals to where it counts most, the community. We also know that health is determined to a large extent by what is called the social determinants of health that are responsible for 90% of individual longevity. For example, housing, food, education, access to water and sanitation, employment, transportation, and so on, are determinants that really are responsible for 90% of the length of the time we will spend on this earth, whereas the biomedical determinants account only for 10 to 15%. To tackle these and to tackle these health inequities, health professionals must develop alliances across sectors and work proactively with community partners. Lastly, I would like to share a couple of reflections with you. We can all see that the measures needed to be taken to stop this pandemic will not work in isolation. They will require global solidarity and global cooperation. We are only as strong as the weakest health system in this world. We also hear that there is a so-called post-COVID new normal, as if context doesn't count. We must recognize that poorer countries face their own specific issues, and they cannot be prescribed by wealthier countries actions that don't fit their context. Public health and social measures have demonstrated that they are effective in limiting the spread of COVID. They are physical distancing, local lockdown and confinement, schools and business closure. But their direct applicability in many poorer countries where economic and social conditions are widely diverse and dissimilar from ours, their applicability remains unclear. African countries must be supported in generating the evidence, their evidence, in their own context, to develop their policies and strategies to limit the social and economic disruption caused by the pandemic and prepare for the next crisis. COVID is a precursor of things to come, and this thing will happen. However, I remain optimistic for the future. The COVID pandemic is an historical opportunity for change. It is an opportunity to get rid of the old normal, and in this regard, the Sustainable Development Goals agreed by the United Nations are paving the road to build a better, more equitable and sustainable world where no one is left behind. Thank you very much. Merci. Foi